Yeah, today's topic is current threat and management of hepatitis. That is a proactive approach. Hepatitis. This is an inflammatory disease of the liver characterized by liver cell damage and jaundice. The liver is the largest glandular organ in the body, saddled with the responsibility of production of bile, which aid digestion, storage of glycogen and amino acid, conversion of protein and carbohydrate to ammonia and acid glycogen, conversion of excess glycogen to meet amino acid deficiency, regulation of hormonal imbalance, drug metabolism. The clinical symptoms: mid fever with anorexia, fatigue, headache, stomachache, itching skin, weight loss, nausea, muscular and joint pain, dark color urine, pale color stroke, jaundice. Type of hepatitis. This classification has been carried out according to the causal agent: drug-induced hepatitis, alcohol-induced hepatitis, autoimmune hepatitis, and viral hepatitis. Drug-induced hepatitis. This usually arises as a result of a toxic event of a drug and other herbal substances which are usually consumed by the populace. Inasmuch as drugs have medicinal effect, when abused can result to other medical challenges. Alcohol-induced hepatitis is the harmful effect of ethanol found in alcoholic beverages is responsible for this type of hepatitis. Autoimmune hepatitis is the activities of the body disimmunity, which accidentally affect the liver cell. This type of hepatitis can be hereditary but though not common. Viral hepatitis. This is the activity of some group of viruses which adversely affect the functionality of the liver. Other organization has identified that different types of virus to be responsible for viral hepatitis, among which are hepatitis A, virus B, C, D, and E virus. Now, modes of transmission. Hepatitis A virus is principally a food and waterborne disease. The hepatitis B virus is sexually and bloodborne infection. Hepatitis C is only a bloodborne infection. Hepatitis A virus is sexually and bloodborne infection. Hepatitis E virus is a food and waterborne disease. Managing hepatitis need a multidisciplinary team approach. The aim of management is to prevent infection and reduce the severity of the liver damage, which will furthermore reduce further liver complications. Behavioral change should be deemed necessary to avoid the consumption of substances that will further severe the condition. Alcoholic beverages should be avoided as well as self-medication. Dietary taboos are essential to enable the liver recover faster by avoiding food containing saturated fat, which cannot easily digest, most especially those of animal origin. Patients should get enough rest. Health workers should be needle smart by avoiding the camping of needles. Barrier nursing should be strictly adhered to. Skin piercing instruments should be disposed in a safe container. All body fluids should be treated as biohazard. Any blood-containing equipment be disinfected with a dilute solution of sodium hypochlorite. All newly-born should be vaccinated within the first 24 hours to prevent vertical transmission. Vaccines are only meant for those who are not infected, so on no account should vaccine be administered without knowing the client's status. Vaccine should be administered immediately after testing to ensure clients are not infected, because allowing it to stay for a while, the client may be infected in between. When diagnosed reactive for surface antigen, none all clients require treatment except those with symptoms. Or better still, a shift from a normal in the liver function test will be better index for commencing treatment. Inasmuch as there is no standard treatment for hepatitis but the use of antiviral like lamivudine, ribavirin, alpha interferon and the phospholipids like silicon and essential fat are being recommended by CDC. Conclusion: the role of communication should not be relegated to the backbench because it will give you a clue on what to tell the client to do or avoid, so that your effort will not tantamount to waste of time and resources. Thank you.